Hi, so what's your name, what's your background, and where are you from?
My name is Frits van Rhee. I work at the Myeloma Institute at the University of Arkansas in Little Rock. I'm a hematologist. I got my medical degree in Holland and then went to England and trained there in Oxford and in London. Did my PhD, worked at the National Institute of Health, and now I'm focusing on multiple myeloma, a disease where interleukin-6 is also of importance. And I get many patients referred from all over the country and sometimes abroad with Castleman's disease.
So that's how you first became interested in Castleman disease, was your research in multiple myeloma?
We already had some patients coming to our center with Castleman's disease, and we decided, because the disease is so rare, that one person should focus on it rather than have multiple doctors seeing a limited number of patients. Our group was also the very first one to use an interleukin-6 antibody for Castleman's disease in 1994, in fact.
And so then what is your involvement with the CDCN, and what do you see its role going forward in advancing research?
I think CDCN is a great organization. It's really a galvanizer for patients and also physicians to come together, to get patient advocacy going, to give patients the correct information. There's a lot of misinformation about Castleman's disease. It's a forum for patients and physicians to connect, and the ultimate goal of the CDCN is also to support scientific research so that we can understand the origin and the causes of Castleman's disease. Castleman's disease is not only a rare disease, it's also quite a heterogeneous disorder, so it's quite complex. And you need to see quite a few patients in order to be able to figure out who benefits from what type of treatment.
And as far as that goes, what advancements or even research that you're doing on your own are you excited about for the future?
Well, we've recently done a randomized trial. That is the first clinical trial in Castleman's disease, allocating patients to either a fake drug, which is called a placebo, or a new antibody which neutralizes a substance called interleukin-6. Interleukin-6 is the driver of the disease in a group of Castleman's patients. Interleukin-6 is what goes up when you have the flu and you get symptoms of fever, tiredness, fatigue, and if patients get severely ill, they could get organ failure and even die. So this clinical trial was the first of its kind in Castleman's disease, and it shows that the drug, which is called cetuximab, which neutralizes interleukin-6, has a significant effect in a good proportion of patients. So it's the first evidence-based drug developed specifically for Castleman's disease, and this pertains to Castleman's disease patients who are negative for the HIV virus and for a virus called human herpes virus type 8.
Right. And what would you say to other researchers who want to get involved, or physicians who are looking for more information?
I think we really want to understand what is driving the disease. We understand that in a significant proportion of patients, interleukin-6 is elevated and causes symptoms. We have a drug which neutralizes interleukin-6. It's effective, but it needs to be given continuous, so it's not a cure. And we need to be able to figure out why patients' interleukin-6 is elevated, which could be for a combination of reasons. Maybe some patients may have an as yet undiscovered virus which drives the production of interleukin-6. In another group of patients, they may have a small malignancy which drives the disease. So there are several hypotheses which we would like to see explored.
And then what would you say to patients out there who are looking for more information, or maybe their families as well?
I think they should look for information on the website. It's the website of the collaborative Castleman Disease network, and there's a lot of good information there. The other thing which is important to realize is that Castleman disease is a rare disease, and the community oncologist may only see one patient in his whole career. So it's important to connect with a doctor who actually has experience with this disease and who sees these patients on a regular basis. The way I work is I evaluate the patient, make a treatment plan, and then it gets implemented locally. So they don't need to live in Little Rock, they can have their treatment locally wherever they live. But it is important to get your treatment directed in such a rare disorder by a physician who's actually got experience with it.
Thank you, Dr. van Rhee.